The chief priest of Teshi, Osabu Ayikubulomonumu Bedu Odano Diapiensa I, has called on the chiefs and people of the town to use the occasion of their annual Homowo festival to unite and plan for the betterment of their traditional area. Teshi has been recently characterized by fierce chieftaincy conflict, through which a number of people got injured. But the chief priest said it all should be a thing of the past. We do apologize for the hitch in that video. Bring you visuals of that story in our subsequent bulletins. Two other stories. Gadangme, Oklahoma, under the auspices of the Gadangme International of USA and Canada, has donated some hospital equipment to the Adabraka Polyclinic to help improve health care. Some of the items include pulse and blood pressure testing kits, amongst others.
We have a hospital in Oklahoma City that donated 13 IV pumps. And we, the members of Gadangme of Oklahoma, we bought a whole lot of items like pulse oximeters, which can be used to check oxygen saturation. We have stethoscopes that we bought, about 50 of them. We have blood pressure cuffs that we also bought. We have mosquito nets that we also bought. So we are under the auspices of Gadangme International, USA and Canada. And we have about 14 states. They also have been donating medical equipment to hospitals in Ghana. So it's not only Gadangme of Oklahoma that have been performing these duties. We bought the items, we ship them with our own money, and then we have to pay duties on them. We call on the government to be able to help us with the duties that we pay on. So if they can establish an office, whether with diaspora, the office, or with Ministry of Health, just a single person, so that anybody in the world shipping medical equipment to the United States, to Ghana, can be able to call that person for the duties to be waived.
We start instituting interventions like giving oxygen. The patients are improving, we monitor and we know. If they are not improving, we use the pulse oximeter and then we know. We've also been giving disposable stethoscopes, which is a very, very good thing. We would like to thank them as well, because most of the time we use our usual stethoscopes in examining the patients. When we are done, we have to disinfect it. It takes time to disinfect it before we can examine the next patient. There is a risk in doing that. But with these disposable stethoscopes, we would be able to use them and then reduce the risk. Because all we do in the hospital, apart from the treatment, we are also doing some prevention bit as well. So that is also going to help. We've been giving some face masks, face shields as well, and we thank them. And then blood pressure cuffs as well. Those are also going to help us, because sometimes COVID, there are people with hypertension, diabetes. Usually when they get a COVID, it's more riskier for them. So with these blood pressure cuffs, we'll be able to monitor their BPs more regularly as well. So we thank them, and then we thank Gadangme International as well, and all the other subgroups within this Gadangme International. We would like to encourage them to keep on helping us.